that all of you are dietitians or some of you are wellness coaches. So what is the designation of the audience? So I would request every one of you to please put in the chat box. Everybody, your designations. Are you a wellness coach? Are you a dietitian? Are you a nutritionist? Or are you a student? Let's make this session a little interactive, else I'll also get bored and you will also get bored. We will not enjoy learning about something which is very, very, very important for us and which is of, very much significant in, today's environment, especially for dietitians. Everybody in the meet, quickly, just apply with your designation. Okay, dietitian, clinical dietitian. I could see Nishita, I could see Javeria, I could see Kirtita, I could see Hema, Aliza, Pallavi, Krasta, Harshita. Divya. I would love to welcome all of you. So today we are going to discuss a very important topic, which is of, significance to all of us. Many of the times we are told that we cannot prescribe supplements ideally with, the degrees which we have, which is somewhat true. Okay. So in today's world, it's of a great need for a dietitian to be a certified dietary supplement practitioner as well. Okay. So in just 2 minutes, we'll talk that why do you need to be a certified dietary supplement practitioner as well? What are the factors which we, need to, I would say, relearn about supplements? And what are the factors which we need to keep into consideration about supplements? There are a variety of, factors like formulation or why the supplements are necessary, why people need supplements, and we'll also be talking about the percentage of people who are just running towards supplements and the categories also I have divided. Okay. So are we ready to explore the role of supplements? So I'll be taking up
Yes.
this session for around 35 to 40 minutes. Then we'll have dietitian Deepali Verma. She'll be explaining, she'll be giving you more of knowledge of supplements. So this is going to be a very, very, very nice session for all of you. Be there, be interactive. Okay. Allow me a moment. I'll just present my screen. Is the screen visible? Everybody, any one of you can hear?
Yes, ma'am.
Yes?
Visible, ma'am.
Yes. Okay.
Ma'am, one more doubt, ma'am.
Yes, please. Quickly. So, guys, first thing first, whatever doubt you have during the class, you can write it down in the chat box. Okay. So, as soon as we'll be moving towards each slide, whatever doubt you present, you can write it down in the chat box, and we'll be taking all the doubts at the end of the session because it would become very inconvenient for us to stop in between and then, take all the doubts. So, whatever doubts you have, put it down in the chat box. See, I have been a dietitian and a certified dietary supplement practitioner with over 18 plus years of experience. So, today I'm going to give you a very comprehensive explanation of why dietitians should have in-depth knowledge about supplements. Okay. So, and how it covers their professional credibility and it's helpful in generating that practical revenue benefit as well. See, a dietitian who is a certified dietary supplement practitioner is always a step above a person who is just a dietitian. Okay, because supplements, we'll be talking about it later in our upcoming slides as well. That how it is becoming a need in today's world. What are the factors that people are considering uh, in making those supplements a need in today's world? Okay. So why dietitians should know all about supplements? The first point would be for complete patient or client care. See, many clients, they already use supplements, often without guidance. Okay. So if dietitians, they don't know about them, patients may rely on unqualified sources. Everybody, could you please mute yourself? There is somebody who is unmute and it's creating a little disturbance. Coming back. So patients may rely on unqualified sources. It could be friends, it could be influencers, it could be sales apps, or it could be MRs, or it could be, daily reels which come on what are the supplements which should be taken, when it should be taken without any proper evidence or sources. Okay. So understanding supplements, it ensures safe evidence-based recommendation, reducing the risk of nutrient overdoses as well. Okay. So this would elevate dietitians as holistic experts, not just food planners. The second point would be bridging nutrition gaps. See, despite a balanced diet, deficiencies, you might agree that deficiencies, they are very common, whether it's vitamin D, whether it's vitamin B12, whether it's iron, whether it's omega-3, or whether it's magnesium. So supplements, they can help close that gap, which is caused by lifestyle, disease conditions, maybe poor soil quality, or any kind of dietary restrictions. It could be, vegetarianism, it could be veganism, it could be gluten free, any kind of dietary restrictions. Okay. So when dietitians, they know exactly when and how to use supplements, they become more effective in the personalized nutrition therapy. Okay. Third point, which I'll be coming on to, would be enhanced clinical outcomes. So supplement knowledge, it would improve treatment results in the case of chronic conditions. Okay. So if a person has PCOS, if a person has diabetes, if a person has cardiovascular disease, or maybe hypothyroidism, or any kind of metabolic dysfunction. Okay. So for example, if a dietitian, guides a PCOS patient on using myoinositol or maybe N-acetylcysteine, which may improve ovulation outcomes more than the diet alone. It actually becomes effective. Okay. So improved outcomes would result into more trust, would result into more reference, and would result into long-time clients as well. Okay. See, clients, they expect, dietitians to be the go-to professionals for all things, whether it's, nutrition, whether it's their diet, whether it's their lifestyle, whether it's the supplementation part. So when you confidently address supplement queries, the dosage, or maybe the forms, or the brands, or the safety, so you position yourself above those non-qualified competitors. For example, we might have seen many gym trainers. They just prescribe that you should have 150 gram of protein or 200 gram of protein without any kind of analysis, or whether that person should take whey protein or whether that person should take plant pea protein. They do not do any kind of analysis. They just prescribe. So you are going to rise above those because you would be a certified person for those things. Okay. The next thing which I would like to put into your notice would be prevention of any kind of misinformation and myths. See, clients, they are bombarded with marketing hype. It could be fat burners, it could be detox pills, it could be miracle vitamins. So if registered dietitians, if certified dietary supplement practitioners, they do not step in, clients, they waste money or harm themselves. As a result, we and our profession is going to suffer. They'll just tell us, okay, you are a dietitian, so I know you might don't know that what should be taken in or what should not be taken. So these kind of things you might listen from them. This is very common. The next is premium consulting service. The supplement knowledge, it allows dietitian to specialize in a niche area. It could be sports nutrition, it could be fertility, or it could be encore, it could be gut health as well. So when we talk about revenue generation, which is very, very, very important for us as well. Okay. Nobody is there. I would be very frank. Nobody is there to do any kind of charity for anybody. Right. So clients, they actually pay premium to those who are, who knows everything about food, nutrition, and supplementation, like everything. Okay. The next thing which I would like to talk would be increased client retention. You would be able to build in trust with them. Okay. That, okay, this person, she knows all about supplements. She knows if I'm a diabetic and if I have a metabolic dysfunction, I'm not able to absorb maybe nutrients properly. So what could be done in order to, minimize deficiency? So these things, they might cross their mind. So only dietitians, they lose client very quickly because people think, okay, now I have got my diet plan, it's done. I do not require anything from her. Okay. But the supplement guided clients, they stay longer for monitoring, for the dosage adjustments, for lab tracking as well. So this also leads to higher client retention. Okay. Again, I would just give you a very small example that it also helps in generating like 10x revenue. Okay. So dietitians who master supplements, they transform from being just diet planners into an integrative wellness professionals as well as entrepreneurs. That doesn't mean that you can just sit and, just advertise or prescribe or any kind of supplement. No, ethics should also come into practice. You should always know which supplement is better, which your client should choose, which brand is more effective. All these things have to be taken into consideration. I'm not advocating that you have to, in order to generate revenue, you can prescribe any supplements and you can get in touch with any of the MRs and keep prescribing supplements. No, you just have to understand which works best for your clients. Okay. So the next question would be, more people, they invest in supplement. Why? So what motivates them to use supplements? Okay. So now we'll be taking up some factors and we'll be also understanding the percentage population which is, involved in investing supplements and why they are involved in investing so much. Okay. So you could see a table where I have made that what is the motivation beside using supplements. Then there are the reasons and the percent population who would like to invest in so. The first would be rising health awareness through social media. 45% of people, all of these percent population and everything is research based. Okay. So 45% of people, they are more informed through maybe social media, maybe health apps or wellness blogs. Okay. So they want to take control of their health rather than wait for disease. Supplements, they see supplements as a very quick or maybe proactive step towards wellness. Okay. So you can see what you are missing on if you are not certified in dietary supplement practitioner thing. Second thing, nutrient deficiencies are very common nowadays. It may be due to processed foods or maybe poor dietary patterns. Okay. So you might see many people, they go for vitamin D, they go for vitamin B12, they go for iron or maybe omega 3 or maybe, magnesium supplements that do not have a proper sleep. So people, they use supplements to fill their daily nutrition gap as well. 56% of population does that. Okay. Busy lifestyle and for convenience as well. So many people, they cannot cook balanced meals daily. Okay. The supplements, it provide convenient nutrition to them, which is a very wrong thing. Okay. So studying about supplements, it doesn't mean that you just need to give them supplements and just let them throw away their normal meal plates. It doesn't mean that. We need to be an advocate for supplement when there is a deficiency or when there is a need. Okay. So many people, they have a preventive health mindset. The shift is from maybe treating disease to preventing diseases. There are very, variety of supplements like probiotics or maybe antioxidants or maybe omega 3s, which are marketed as preventive tools for immunity, for brain health, for gut health, and for heart health as well. Okay. So you might see many influencers or maybe athletes or celebrities, they promote supplements. They promote trends actually, like protein powders, they promote collagen, they promote biotin, they promote pre-workouts, they promote fat burners, even without knowing that what is going to be the side effect, what is the safest level, what could be the toxicity level, or which brand is the best. Okay. Even doctors, they have been recommending, supplements. Uh, they have been tying up with many, MRs, and they have been advocating supplements. Okay. Even when we talk about the aging population, so these older adults, they face declining nutrient absorption. Supplements, it helps them maintain bone health, maybe cognition, immunity, and making them, a very growing market among seniors. There's a rise in chronic disease as well. So when a person has diabetes, or maybe PCOS, or maybe obesity, or cardiovascular diseases, or hypothyroidism, so all of them, they benefit from uh, adjunct supplement therapy. So people, they invest in supplement to manage these conditions naturally along medicines. Okay. We could also see the post-COVID health consciousness. So the pandemic, it accelerated demand for immunity boosters like vitamin C, or maybe zinc, or vitamin D, or herbal blends like ashwagandha. So people, they continue investing in supplements for long-term immune resilience as well. They might do it for aesthetic and beauty influence as well. So you might see that when we talk about beautification for like skin, hair, and nails, 67% of population, they are onto supplements without realizing that they can do it from natural diet maybe, and they require it when they actually have deficiency, or they are facing any kind of health issues due to that. Okay. So now we'll be discussing the type of supplements, okay, which are readily available in the market. So I'm going to give you a detailed classification. I'm just going to speak up. I'm not going to, present a very beautiful overview, something like that. I really want everybody to listen. Okay. So there are a variety of supplements. The first one would be vitamins, like essential micronutrients or organic compounds. Okay. So we might see supplements for vitamin B complex, or maybe vitamin A, D, E, and K. Okay, multivitamin tablets, or vitamin C chewables, or maybe vitamin 3, D3 drops as well, which is very common for immunity, or maybe energy, or maybe bone strength. Then we have minerals. These are, inorganic essential micronutrients. So you might see many examples like calcium plus vitamin D tablets, or maybe iron folic acid capsules, or maybe magnesium citrate, or magnesium gluconate, magnesium glycinate. Variety of magnesiums are available. Okay. Then we have protein and amino acid supplements. Uh, we could say essential amino acids, or branched chain amino acids, or protein powders like whey, casein, soy, pea, hemp, and collagen. Then we have essential fatty acids, omega-3 and omega-6, the algal oil, or flaxseed oil, or maybe fish oil capsules, evening primrose oil capsules, all of them. Then again, we have herbal and botanical supplements, which are, very broadly classified, like adaptogenic, or maybe for digestive health, like ginger, peppermint, or licorice, or for immune support, when we talk about turmeric, ginger, and garlic, okay, matcha root, or maybe fenugreek, or black cohosh, all these are herbal supplements. Then we have probiotics and prebiotics, like lactobacillus or bifidobacterium, so many of them, okay. We have hormone and metabolic support supplements like myo-inositol. Then we have performance boosters like electrolytes, caffeine, beta-alanine, and nitrates. Then we have fat burners like the weight management supplements, okay. Specialty supplements, maybe for eye health, or joint health, or antioxidants. Even some people go on and take meal replacements and functional foods as well. Okay. So again, the next question which arises would be, are these supplements regulated? Okay. So regulated from manufacturing till quality testing, till labeling, till advertising. So when we are saying know your supplements, we need to know each and everything about supplements, how they are regulated, how the raw material sourcing is done, how the manufacturing is done, okay, how the quality testing is done, and even advertising and marketing regulations. Are they satisfying all these conditions? I would suggest you, before you are prescribing any of the supplements, you need to understand whether these supplements are regulated or not. You need to just, uh, look at the wrapper behind. You just don't need to know the RDA. You also need to know the ingredients, because there are many ingredients which are not readily absorbed, or whose bioavailability is low, or maybe absorptive potential is low as well. So all these factors have to be kept into consideration. The next point is, are they really needed? So I would say yes in the case of deficiencies, and maybe in the case of life stages demand as well. In the case of, female who is pregnant or who is lactating, or maybe she's an elderly, or if a person is an athlete, okay, or if any of them has dietary restrictions, or in the case of medical conditions, or if they have any kind of GI disorders, or maybe stress, infections, and medications. That is the condition why you need supplements. Okay. Okay. So we'll be talking about the shapes and form of supplements in the formulation table. I'll be telling you all about that. So what can you see when you decide that which type and brand is effective? Okay. So how can you help your clients choose? Or how can we tell how effective a supplement is? Okay. So when choosing a supplement brand for your client, you need to see whether it's GMP certified. Okay. GMP as in good manufacturing practices. If you want to take notes, you can take notes as well. Okay. So you have to see whether it's GMP certified. Okay. Whether it's FSSAI approved, FSSAI approved. Okay. Because it ensures purity, potency, and safety. You need to understand the ingredient transparency. Okay. So you have to see the clear labeling with exact amount. You have to see the bioavailable form. So if I talk about the bioavailable form, when we compare magnesium oxide and magnesium glycinate, we know that magnesium glycinate is more bioavailable. Okay. Or when we talk about, plant vitamin D3 and animal or life-giving vitamin D3, we know that animal vitamin D3 is more bioavailable. So you know, um, we should know whether the compound is bioavailable or not. It should not have any kind of unnecessary artificial colors or additives. Okay. The formulation should be evidence based, and the testing and quality assurance, like the COA, certificate of analysis, it should be certified. Okay. It should have a good reputation. So when we talk about, absorption, so we have, अभी कोविड के टाइम बहुत ज्यादा ये चला था कि people they just used to sip on turmeric waters. सबको ये था कि curcumin is going to save them from getting COVID, and they just used to sip on turmeric waters. Okay. So I would love to tell you that turmeric, it just contains 2 to 3% of turmeric, which is like maybe 10 to 12 mg. And that is also not, its absorptive potential is very low. Its bioavailability is very low. Okay. We'll be talking about absorptive potential, bioavailability later on. So instead of going ahead with turmeric water, it's better to go ahead with curcumin. Okay. So curcumin is the main compound which we are looking for actually. We are not looking for turmeric. We are looking for curcumin. So we need to understand the form and bioavailability as well. In fact, there are some chelated minerals like iron bisglycinate or magnesium bisglycinate. They are better absorbed. Even when we talk about the forms, the liquid form, they are, faster absorbed. When we talk about vitamin C and glutathione, they are better absorbed when they are taken with any fluid, specifically water. Okay. The cheapest isn't always the best. It may compromise quality. Expensive isn't always superior. Sometimes it's just branding. You need to focus on value per dose and what is the clinical effectiveness. Okay. How can you help your clients choose? First of all, access the need. You can run through diet recall with blood test or medical history. You need to educate on evidence, explain why one form is better, clarify the safe dosage. You need to recommend trusted brands, as I told you, what you can see in them. Need to customize to individuals like athletes, they require performance supplements, or PCS clients, they may require hormonal or metabolic support, or even seniors, they may require bone health supplements like maybe calcium, D3, K2, and magnesium. Okay. So supplements, they should be chosen based on need, safety, bioavailability, certification, and trustworthiness. Okay. You may add value by preventing misuse, by helping clients avoid low quality and unsafe brands, by selecting evidence based, clinically proven options that truly support health. Okay. So these are the factors which would check the effectiveness of the supplements. Okay. The first being the formulation, whether it's in the form of a tablet or maybe drop or maybe soft gels. What are the fillers used? What are the binders used? Do they have lubricants? Okay. Or what is the best type? The second factor would be transport and storage. See, many supplements, they degrade, they lose their shelf life. Okay. They also, we'll be talking about it in the next table. They also, they are very susceptible to lights, maybe oxygen, even moisture, fermentation, and degradation as well. The third would be dosage active ingredient. So they contain enough dose which my client requires. Okay. So if we talk about omega-3 specifically, a person who is healthy may require less amount of EPA and DHA as compared to a person who has a heart disease. Okay. The fourth point would be absorptive potential. So how much of the active compound is absorbed? Okay. Then we have bioavailability, which is a step further. There's a vast difference between absorptive potential and bioavailability. Bioavailability tells you whether how much of the supplement makes to the site of action. So if you are taking a supplement which is good for your joint health, okay, then how much of that supplement, it may be mg or it may be grams, it's reaching to that site of action. Okay. Then we have combination. So is that combination enhancing or hindering absorption? Every supplement they would might need a combination which would enhance their absorption, or they would not need a combination which may hinder their absorption. Time of the day taken, which time of the day a supplement can be taken. For example, probiotics, they have to be taken in the morning on an empty stomach. So many of us, they give probiotics in lunch. We just say that, okay, curd is a probiotic, let's have it in lunch. No, probiotics should be taken in the morning. Okay, when a person has come from the fasted state. The supplements can be taken with food, no food, or which food. Even the safety and the toxicity levels, how safe they are. Okay, and how risky they are, or what could be the side effects, or what could be the toxicity levels. I have formulated a table. I'll be explaining it. Okay. In the meanwhile, I just want you to go through this table. That what could be the formulation type, whether it's in a tablet form or it's in a drop form or it's in a soft gel form. A little description about it. What could be the advantage, as in it's cheap or maybe stable, it has a long shelf life, or what could be the disadvantage and what is the effectiveness. Okay. So formulation, it refers to how the supplement or drug is prepared for consumption. So when we talk about form types, it could be tablets, it could be drops, it could be soft gels, it could be powders, it could be effervescent pill, it could be a tea bag as well. Okay. So it could be fillers could be used to make it, or maybe lubricants could be used to make it. There could be a certain coating of a color also. So even the molecular structure has to be taken into consideration, which determines the solubility and the absorption. Okay. And then we have effectiveness, that which type is the best. Okay. When we talk about fillers which add bulk to supplements, for example, lactose or cellulose. Then we have binders which hold those tablets together. It may be starch or it may be gelatin. Okay. Then we have lubricants which aid in the manufacturing process. For example, magnesium stearate. Then we have the enteric coating, which may protect from stomach acid, or they may improve swelling as well. So all of these things, they directly affect the release rate, the absorption, the tolerability, and the shelf life. So if you're looking for fast action, you can go ahead with drops, you can go ahead with powders, you can go ahead with effervescent pills. Okay. For fat soluble nutrients like vitamin D, E, and omega-3, soft gels are the better forms. For cost effectiveness and long-term stability, we use tablets. For herbal and natural therapies, tea bags, though they are less potent, but they can be used for if convenience, like just like that. You can use drinks or ready to use liquids. Okay, you can see in the table. See, when we talk about tablets, they are the compressed solid form. They are really cheap. They are stable, or they have a little long shelf life. Okay, even the dosing is very easy. You just have to swallow it. But for some people, like if you talk about elderly, it's harder to swallow for them. The breakdown is slower. It may contain many fillers. Okay, so sometimes what happens, the ingredient which we actually require is less and the filler is more. Okay, so it would require disintegration. Disintegration as a complete breakage before absorption. Then we have drops. They are quickly absorbed. They are very easy for children, maybe elderly, or maybe for flexible dosing. They are less stable. They require preservatives. And when they are exposed to maybe, in the next slide, we'll be talking about transportation and storage. So when they are exposed to heat or maybe sunlight, they develop these tissues. Okay. Then we have soft gels. They are gelatin capsules. They are more costly, but they mask taste. They are very easy to swallow. Okay. Uh, when we talk about fat soluble vitamin absorption, soft gels are the best. They are excellent for fat soluble nutrients. Then we have powders. So powders, they are easy for high doses. For example, if you want to take in 30 gram of maybe psyllium husk, you can just take a tablespoon. Okay. So it may require complete mixing, like good mixing, okay, and they are less portable. Again, we have talked about the effervescent pill, the tablet that dissolves in the water with a fizz. The absorption is very fast. They are gentle on stomach. They have better palatability. So when we talk about collagen, we talk about glutathione, they generally come in effervescent pills. Okay. Then we have tea bags. The herbs keep in hot water. They are natural. They are gentle. The compound is really soothing, but the dosage is inconsistent. If we require like 5 gram of a compound, we don't know whether that 5 gram is present in that particular tea bag or not. Okay. The tea bag may be of a 10 gram, it may weigh 10 gram, but how much compound it has, that's actually unknown. Okay. So now we'll be talking about storage. I have made a table. You can go ahead and read it. See, transportation and storage. We have already talked about formulation. So now transportation and storage. There are like 5 factors. So even a perfectly formulated product, it will underperform if the supply chain exposes it to maybe light or maybe air or maybe humidity. Okay. Or maybe packaging and handling. All of these things are not taken into consideration. So there are some supplements when they are exposed to lights, their color changes. There is a person degradation as well. If they are exposed to oxygen, so there would be loss of activity. If they are, exposed to moisture, the capsule maybe it softens, it also support microbial growth. Okay. In the case of fermentation, so unwanted microbial activity in liquids or moist powders, it might generate gas and pressure. It might degrade as well with time and interactions with packaging. Okay, so there should be an optimized temperature control, moisture control, and oxygen control as well. Okay. So when we talk about light, see, there are many supplements which degrade under light. For example, vitamin B2 and vitamin B12. Okay, they degrade under light. Omega 3, it also oxidizes very faster in clear water or maybe under light. So you need to use a opaque plastic or maybe amber glass bottles. You need to avoid transparent bottles. You need to store them in dark, cool places. People, what they do, they just keep their omega 3 bottles or vitamin B12 capsules in front of them on their table. So it is degrading. Its quality is decreasing. Okay. So you need to make sure that you are storing those supplements in a proper way. Okay. Then we have vitamin C. Okay, vitamin C, it oxidizes in the presence of oxygen. It becomes less effective. Okay, even omega 3s, they develop rancid smell. Even coenzyme Q10, it's very oxygen sensitive. So when we talk about practical handling, it should be, kept in tightly sealed containers, especially for powders and oils. We have to save them from, from oxygen entering inside them. There are supplements like probiotics, or maybe magnesium, or maybe creatine powders. They lose their viability when they are exposed to moisture and humidity. Okay, so the seal lid should be very tight, and the customers, the consumers should be instructed to not to store into any places, like, maybe they are keeping it in their bathrooms, or maybe they are keeping it in their kitchen. So it should not be kept like that. Okay. Then we have herbal syrups, which can ferment if preservatives are weak. The collagen powders with sweeteners, they can also ferment if not dried well. Okay. So you need to refrigerate them. The probiotics and even syrups and even the collagen powders, they have to be refrigerated. Okay. So vitamin D, B complex, probiotics, they have to be saved from heat. Even maybe if there is vibration in trucks as well, the tablet coatings, it might crack. Okay. So transport and storage vulnerabilities are just as important as formulation. Even a high quality supplement can lose 50 to 90% of its potency if poorly stored. Okay, so I have made a table which will show you what can damage it during shipping storage, what you'll notice if it goes bad, and how to keep it safe. You can take a screenshot of the table. So I would also like to tell you the percent degradation. It will just take 2 minutes. So vitamin C, it degrades around 30 to 70% with high humidity and within 2 months of packaging. Okay. So vitamin B12, it degrades around 20 to 40% within 3 months of packaging. Then we have folate, it degrades around 40 to 60%. The potency is lost, like 40 to 60% potency is lost. Okay. Even vitamin D3, it loses around 30% of its potency within 4 months of packaging. 25 to 50% of fish oil, it's oxidized within 6 weeks if it's unprotected. Okay. Then we have coenzyme Q10, we have probiotics, which lose approximately 90% within 1 month if there is no cold chain. All the magnesium salts, they might form clumps as well, or they might form cakes as well. Okay. The next point is dosage active ingredient. So the dosage active ingredient, the first question would be, is the dose strong enough? So supplements work only if the amount is enough for the body. Too little, that means no benefit. Okay. Is the rest just fillers? So some capsules, they are mostly sugar, they are mostly starch or other additives. So this lowers the quality and wastes money as well. Does the product give you enough ingredients? See, the working part of the supplement should be in the right quantity. Marketing, it often shows big numbers that are misleading. Okay. Even clinical effect is equal to correct dose. Even if the ingredient is high quality, if the dosage is too small, the supplement won't work. So always check if the listed doses refers to raw ingredient or the active form. Okay. So tablets or capsules, they might look big, but often most of the weight is not the active nutrient. So supplements, for example, 50 mg of vitamin C will not give the same immune benefit as 500 mg. You should always know the correct dose which is required for the person. Okay. Even a fish oil soft gel may contain 100 mg fish oil, but actually it contains around 300 mg of EPA and DHA, which is the active part. Okay. Many cheap supplements, they are bulk filled with inactive fillers, maybe binders or maybe carriers. For example, a turmeric capsule may say 500 mg, but only 50 mg is active curcuminoids. The rest is just turmeric powder. Okay. So if a healthy person, it requires 500 mg of curcuminoids, do not confuse it with turmeric. The next we have is absorptive potential. So the big question isn't just what's on the label, it's how much of the active actually gets from your gut into your blood. Okay. So I've also made a table in the dosage form for liquid powders, for effervescent tablets, okay, and all of these things. So the most important factors that decide the absorptive potential is solubility in the gut. So if it doesn't dissolve, it cannot be absorbed. So liquids in effervescence, they start dissolved, and big hard tablets may lag. Okay. Even the smaller particles, they dissolve faster, like micronized or maybe nanoforms. For example, creatine or maybe nanocurcumin. Okay. Some of them would be fat lovers, like fat soluble nutrients. They absorb better with fat or in oil based soft gels. Okay. So that's why it's always advised to take vitamin A, D, E, K, coenzyme Q10, and curcumin with healthy fat. Okay. Then we have water soluble vitamins like C and B. They are fine in water based forms only. Then there are some chemical forms which changes absorption. As I told you, magnesium glycinate is gentle, it's better tolerated, and it's better absorbed than oxide. Even iron bisglycinate is better than ferrous sulfate for many. Okay. So with fat for A, D, E, K, coenzyme Q10 and turmeric, vitamin C, it improves iron, calcium, it blocks iron. Maybe it's the high fiber or tannins, they can reduce mineral absorption as well. So here we have the comparison table, which tells you that which of the dosage is absorbed. Okay. When we talk about liquid drops, it's already dissolved. Okay. It can make a quick contact with the gut wall. The absorption is very fast, it's high, and it's best suited for B vitamins, vitamin D drops, or even herbal tinctures. Then we have those effervescent tablets. For those who are pre-dissolved, they can cause mild acidity. And the speed of onset is fast. The relative absorption is very high. So vitamin C, electrolytes, maybe glutathione, collagen, and some minerals, they come in the form of effervescent tablets. Okay. So there are, even high mineral doses like magnesium and creatine. They these are in the powder form, and they are put in the water. They are best absorbed with water. Okay. So how you can boost absorption? You can take A, D, E, K, curcumin with a meal that has fat. You can take iron with vitamin C. Avoid tea, coffee, calcium within 2 hours. You can split big doses of C, magnesium, and B complex during the day. If you are on acid blockers, okay, then make sure you are not taking vitamin B12 or maybe iron bisglycinate with them. For sensitive stomachs, please choose chelates. Chelates as in maybe magnesium glycinate or iron bisglycinate over harsh salt. Okay. So now we'll be talking about the combinations and the bioavailability. Absorptive potential is very different from bioavailability. Okay. So bioavailability is the percent of nutrient or supplement that actually enters your bloodstream, is available for your body to use, and reaches the target site. Okay. So when you swallow a supplement, not everything makes it into your circulation. Okay. And even some is lost in digestion, some is destroyed by the stomach acid, some gets stuck in the gut, and some is blocked by other nutrients as well. For example, you might swallow 100 mg of curcumin, but only 2 to 5 mg, which is actually 2 to 5%, it reaches your blood if taken alone. The rest is wasted unless the formulation it improves your absorption. Okay. So bioavailability, it answers the question, out of what you take, how much does your body really get? How much does that site of action really get? Okay. There would be a variety of factors that would increase bioavailability. The first would be the formulation, whether they are in the form of liquid, soft gels, or effervescence. These are usually absorbed better than the hard tablets. Solubility in water or fat is the next factor. Then what is the size of the particles? Okay. And how you are combining it, whether you are combining it with hinderers or whether you're combining with enhancers. You need to avoid blockers as well. For example, there are certain medications like antacids, which lower B12 and mineral uptake. Even the timing of intake, like fat-soluble vitamins, they has to be taken, with meals, or maybe minerals. They would be better absorbed on an empty stomach, but it can also cause GI upset for some. Okay. So I've made a table wherein you'll be able to understand what could be the combinations, the best combinations and the bad combinations, and what could be the approx bioavailability. So when we take iron with vitamin C, this is one of the best combinations. The bad combination would be calcium, tea, or coffee. Alone, it gives you like 10 to 15%, but with vitamin C, 25% to 30% is bioavailable at the site of action. Then we have calcium, best combined with vitamin D, worst combined with iron. Alone, 20 to 30% is bioavailable, but with vitamin D, 40 to 50% is bioavailable. Same is the case of vitamin D with fat or with oil, because they are fat-soluble vitamins. So bad combination would be on an empty stomach without fat. Alone, it's 20 to 40%, but with fat meal or soft gel, it becomes 60 to 80%. Magnesium has to be taken with vitamin B6, okay, and has to be avoided with zinc, okay. So alone, 30 to 40% is the bioavailability, but when combined with B6, it becomes 50 to 60%. Zinc with vitamin C, it supports immune energy, but zinc when taken with iron or calcium. You might have heard of a tablet called as Cofol Z, which has zinc and iron both. Many people take it, but they should understand that zinc with high dose of iron and calcium is a very bad combination. So zinc alone provides up to 40% of bioavailability, but with vitamin C, it increases to 50%. Then we have curcumin, which can be taken with black pepper extracts or fat. Alone in the plain powder form is a bad combination. It's less than, it's more than 5% with piperine, but with fat, it's up to 20 to 30%. Then we have coenzyme Q10. So with fat, it's good. Dry tablet with no fat, just water, it's bad. So with fat, if it is taken, then the absorption, the bioavailability is more than 50%. Okay. Probiotics, when taken with prebiotics, fiber like inulin, it's very good. But when taken with antibiotics at the same time, is very bad. So with probiotics, the bioavailability enhances up to 60%. B12, it's absorbed in the mouth, but when it's taken with stomach acid reducing drugs, it's not absorbed. 25% is absorbed when it's taken sublingual. Okay. Then we have fish oil. So fish oil with fat-containing meal, the bioavailability is 70% on an empty stomach. It's just 20%. Okay, so this is going to be my last slide, that how safety and toxicity it helps. Okay. Again, there would be some supplements which has to be taken with food. For example, vitamin A, D, E, K, curcumin, and coenzyme Q10. Iron and probiotics can be taken without food. Okay. So vitamin C-rich foods would help iron absorption. Protein-rich foods would improve zinc absorption. And there would be many foods which can harm, like tea, coffee, high fiber meals, or calcium-rich foods. They can reduce iron and zinc absorption. Okay. So while choosing a supplement, the most important thing which you have to keep in mind would be how safe or risky. So most vitamins and minerals are safe at normal doses, but risk comes with mega doses or long-term use. For example, vitamin C up to 1000 mg per day is safe, but up to 5 to 10 gram daily would cause diarrhea. Okay. Even supplements can cause discomfort if misused. For example, magnesium at high doses may cause diarrhea. Niacin at high doses may cause flushing of skin. Even iron at high doses may cause constipation. Okay. The maximum daily dose before harm is, very much it can be, there. For example, vitamin D, more than 4,000 international unit per day is very harmful. Zinc, 40 mg per day is too much and it causes copper deficiency. Even the toxicity level has to be taken into consideration. So when overdose, it leads to actual poisoning or damage. Vitamin A taken for long term, more than 10,000 international units per day, it might lead to liver damage or birth defects in pregnancy. Even if there is contradictions. So vitamin K is very risky for people who are on blood thinners. They might die as well. Even ashwagandha, it has to be avoided in people with hyperthyroidism. Okay. And iron supplements, it's harmful for people with hemochromatosis. This was all from my side. So whatever questions you have, you can put it down in the chat box. And now I would request Dipali to take it from here, please.
Hi, Neha. Hi,
Hi, Dipali.
everyone. Welcome to the workshop, Know Your Supplements. And you have enough knowledge about the supplements today. Neha explained everything in a very precise manner. Briefly, she explained because it's a very huge topic, we know that. And she explained everything in a very precise manner. You can put your questions there, and I am sharing my screen so that we can start. And once we have the discussion over, then all your questions will be answered. Okay. So let me know if you are, if you can see my screen. I hope you can see my screen, right?
Yes.
Okay. So when it comes to supplementation, it is very important to know it is very important to know that you have enough knowledge about the supplementations, dose, bioavailabilities, and everything because it is really, really important. But the question comes in your mind most of the time when you are dealing with your clients and everyone that do you actually need supplement or not? It's just a fancy thing that you are needing. Okay. Or it is just because, there are so many ads today on Amazon, if you see that so many ads are there, and you can take this supplement so that your bones could be healthy. If you can take this supplement so you can glow internally. We have been like, growing with that ad Fair and Lovely when she says multivitamins, take multivitamins for the skin. So, do you really need supplementations or you don't need supplementation? So the answer in a very short manner is yes. People need supplement even you are healthy, and if you have some sort of uh, deficiency, you need supplement. Why I say that people who are healthy they need supplement is to fill the gap. Okay, we will be reading about that. Why healthy people also are on the edge that you need supplementations that time. Okay. So if somebody asks you that do I actually need supplementations, you need supplementation, but the correct dose, how the product is being made, what exactly the active form that you are taking, how much you need to take, everything needs to be really, really precise and very, very correct. Only then you can suggest your supplements to your client. Now the question comes here that can a dietitian prescribe supplements? So most of us, like you are just passing out. When I passed out my master's, my bachelor's, I used to think that I cannot prescribe supplementations because that's not my job. So, can you prescribe supplementation? Can a dietitian prescribe supplementation? Yes. Our dietitians are trained in nutrition and deficiency. She can prescribe supplement, but important is that you should be well educated, you should be certified, you should know about all those doses, all those researches are made. Okay, you should be learned and mastered before you prescribe your supplements to the client. Okay, then you are totally okay. If you are a certified dietitian in supplementations, you can prescribe supplementations. You cannot prescribe pharmaceutical drugs. Okay, drugs you cannot prescribe, but the supplementations, the nutrition supplementations, the nutrition and nutrient uh, things that you can definitely prescribe to your clients. This is totally your case, but you need to be very validated, very experienced in this because there are so many things when it comes to take in the picture that if you can prescribe a supplement or not. If you're prescribing just an iron supplement to your client or vitamin E supplement to your client, it is very, very important to think and to ask them to think about that how you can prescribe that supplement, what the dosage should be, the brand, and everything takes into the picture. Also, the recent researches, the labels, everything. Okay. So, must ensure right nutrients, right dose, and right person. Okay. You can recommend that should be supported by ICMR researchers and FSSAI. Okay. These are the international guidelines are there. Okay. Then you can prescribe your supplementations. Okay. So definitely you can prescribe the supplements. So be confident while you're reading and you're learning about your supplementation course with us that definitely a dietitian is legalized to prescribe the supplements. Now let's come to know that it's very important and very basic. We all have heard about this many times, nutritional gap. What does exactly mean by nutritional gap? Nutritional gap means there are some factors that can make your nutrition and the absorptions of nutrition make it worse. So all the nutrient that you need for that healthy uh, body, for that healthy manner, that lacks. Okay, so that's how the nutritional gap appears, and the factors that that affects the nutritional gaps are first is changing diet quality. Okay, so today the diet something is like we all have seen that people are having unhealthy eating habits. They are taking so much of refined products, fast foods. Okay, the more fast food you are taking, okay, the more things that are loaded with refined product, trans fats. There, when you uh, have those kind of a food, your digestion gets a bit controlled. Okay, and there are so many things happens inside your body. So the absorption power of the nutrient that you are taking, the food that you are taking, it's completely hindered, and it gets really bad for the head. So whatever nutrient you are taking, whatever food you are taking, that goes into the waste. Okay, I have seen many people they are taking like supplementations. Okay, suppose you are taking uh about like people are taking today like they don't know about the supplement they should need it or not need it, but they are publicity are there, Amazon are there, and they are very cheap. Okay, so they can buy it and they say that okay, I don't it doesn't if they are impacting your health, if they are making you healthy or if they are making you unhealthy, they don't know about it. They just go with the trend, they just go with the advertising, and they are having vitamin C tablet, but they don't know if they can absorb the whole amount of vitamin C or not. Okay, so you are taking 500 mg of vitamin C. Maybe the supplement is cheap. Maybe the brand is really bad. Maybe you need it or not. Maybe the absorption power in your body is there for that vitamin or not. What time you need to take that supplement? Okay, and very important, water soluble supplement, fat soluble supplement. What exactly you need to do to absorb those supplements? So this is very, very important to learn before having any sort of supplement. So changing diet quality, if you change the diet quality, definitely because people are going into the unhealthy eating habits a lot. So most of the foods, most of your digestion power, your enzymes in the stomach, in your pancreas getting really, really dirt, and that's why most of the nutrition you cannot absorb. So you need supplement at that time. Okay, some people are like skipping their breakfast a lot. Many people have this habit of skipping breakfast, skipping lunch, skipping dinner. I don't feel any problem in skipping a meal. The problem is the balanced proportion of the food is not there in their day. Okay, that's why the nutrient absorption gets really bad. And when they feel really, really hungry, they just like overeat. And when you overeat something, definitely it is like storage of most of like fat. And because you are very like you're skipping your like breakfast or something breakfast or other meals also you're really hungry. Most of the time when you're really hungry you crave for some really high carbohydrate foods or something unhealthy. Most of the time you don't want to feel that time healthy and you don't like to eat healthy foods. So your choices also matters a lot when you are taking your food on time or not time. So definitely when it comes to supplementation, timing, Your absorption powers matters even more because supplementation is a very concentrated form of nutrients you are getting in just a small pill. Okay. So if you are taking care of your breakfast, lunch, dinner a lot, what exactly and what impact can a supplement make into your body? Okay, because it is really, really concentrated. So this is the first thing that can impact your nutritional gap. Second is the soil depletion. Okay. Today there are so many things that's being used for soil and crops farming. Okay, like the urea is being used, like the NPK, the DAP is being used. Okay, most of these things are used that your crop, that the farming can get in a very like the speed up to speed up the process. People are using these sort of farming mechanism. Okay, these are good to make the your farming grow in a very good way. That's good. But they most of the time their minerals, the minerals in the plants, the minerals in the crops gets completely and most of the time 50% gets reduced. Okay. Today there are recent researchers we have seen a lot, like in spinach. Earlier, the amount of iron it's being completely reduced. Only 10 to 20% of the iron is being left in the spinach now. Okay, so suppose you are eating really healthy food, still you feel a bit, tiredness, exhaustion after having a good amount of food. Still you feel a bit of exhaustion. Why? Because the cropping, okay, the crop, the farming, okay, they have also a big role to play here. Okay, pesticides, people using pesticides today, okay, to protect the farms, to protect the crops. And when you're using pesticide, most of your antioxidants and vitamin C gets completely destroyed. Okay, so you are taking care of your diet, but the farmers are not taking care of your diet. Okay, so here is a gap. That's how you need supplementation that time also to fill the gap. Then we have the lifestyle stressor. Okay. Today we are in a very fast paced life. Everything we need just in a very quick manner. Okay. When things are very quick, when things are very, very, we need just deadlines are there. We need to make this happen. We need to make that happen. There are so many hundreds and thousands of thoughts are there in your mind every time. The cortisol levels are really high in your body. The more cortisol you have in your body, the more antioxidants you are losing. The more antioxidants you are losing, vitamin E, vitamin C, vitamin A, you are impacting the cortisol, impacting all those vitamins a lot, minerals a lot. Okay. So because of the stress is really high, you are taking care of your diet, but you are not taking care of your mind, then again a gap is there. Okay. So that time also to fill the gap, we require a good amount of supplement, but in a very correct manner. Okay. Then we have the medical conditions. People are having chronic medical conditions like hypothyroidism, diabetes. In diabetes, vitamin B12 level gets affected a lot. Okay. So when you have a chronic medical conditions also, it's always important to suggest a supplement to those people. Okay. Because most of the time their absorption power is not good. Most of the time they're not taking care of their diet also. Okay. So providing good supplementations, one or two at a good time with a good important thing. Can't you? Am I audible?
Yes, ma'am.
Yes, ma'am.
Yes.
Okay.
Yes, ma'am.
All right. All right, guys. So then we have the practical realities. Okay. Even health conscious individuals struggles to meet daily requirements due to busy schedules, irregular meals, or dietary restrictions like vegetarian or vegan diets. Okay. So it is very, very, very important to take care of everything. The gap, these are just five gaps I've written. These are not just five gaps. There are so many gaps we have today. Okay. That can make your nutritional absorption power, that can make you feel a very I have seen many people. This is a, very important case I wanted to share with you. There is a 40 years of old man I consulted. He was an athlete and he was doing everything in a very precise manner, in a very good manner when it comes to diet, when it comes to exercise. He feels really good. I mean, the diet, I cannot even pinpoint a single thing that he's taking back. Okay. So he told me that it's been like 20 years, okay, 15 to 20 years. I have not touched a single sweet in my life. And that's dedication he has towards his diet and his exercise. But he feels very, very lethargic, very lethargic when there is like evening time. He feels really lethargic. Every time he feels really lethargic. The problem is what? The problem is there because the problem could be anything. Maybe the soil depletion was the problem because whatever food he's eating, that is not has the enough, enough amount of uh, iron, enough amount of vitamins, enough amount of minerals in their diet because he thinks that he's taking everything. But then again, he require some sort of help also. Then the supplementations is required and he needs a multivitamin tablet also with that. Okay. Then he feels a bit better, but it's not like a magic pill that you take a multivitamin or you take some sort of supplement, so all your problem won't improve like a very completely reduced. You need to balance because he was main issue with him was his stress levels. Okay, it takes too much, it gets too panic. And when it gets too panic, the cortisol level gets really high. And when the cortisol level gets really high, your body requires more energy. Okay, so whatever you have, it gets very, uh, you know, uh, very fast manner it gets burned. Okay, so that time he just balanced out his mental health also with the supplementation and he feels better. Okay, so it's not just about the food, it's about the overall and the effective manner. Okay, so supplementation is not a fancy thing today. Supplementations require your attention right now because we are at that age where everything is going into very reducing manner. Okay, so whether it is your crops, whether it is farm, whether it is your diet patterns, your mind, everything. So to fill that gap, you require some sort of help. Okay, so it's a help. Then obviously food first and supplementation second. You taking a good amount of supplements like your water, you are taking good amount of vitamin C, everything, but you are not taking care of your diet, you're not taking care of your you're not taking fruits enough, you're not taking water enough, your hydration levels are very bad. No use of that vitamin C supplements you're having in your body. Okay. So it is very important that food first, just take care of the diet first, and then always remember supplementation is a help. Okay, supplementations cannot, replace your diet, your eating habits, your diet plan, your calorie adjustment, your protein, carbs, your nutrient. Okay, it's a help that you require definitely. Okay, then the common deficiencies we have today, Neha also covered that point, and we also know vitamin D is something like every second person, if you test today, vitamin D and vitamin B12, you feel the people are deficient. Okay, and these sort of vitamins are those that most of the time you cannot fulfill from your diet as well. So on those things, definitely you require supplements, right? Iron today, okay, because the cropping, the farming mechanism, and you are not taking care of the most of the green vegetables today, most of the dark green leafy vegetables today. Most of the time, your iron gets really low, particularly common in women due to menstruations and pregnancy, leads to anemia because of the menstruation also. Okay. But I would not say that menstruation is the cause of the iron deficiency. Our body is enough to get that, depleted blood back, the blood iron back. So it's important to take care of your diet. It's important to take care of your holistic, like your, if I see it like a circle, okay, where there is a diet, your mental health, your fitness part, and the extra help that we provide with the supplementation. Okay, then it completes everything. Then we have calcium, calcium absorption. More you age, the calcium, your bone density decreases, and the calcium absorption gets really impacted. So you need calcium supplementation. Or older age people needs calcium, the more than the younger age people. So supplementation is required. So enough knowledge of supplementation is really, really important for all the dietitians because if you don't know how much calcium you need to give to your client, at what age, okay, and you require that you say that 500 mg of calcium you can take or 100, 1000 you can take, but you don't know that how you can do that with a correct absorption power, okay, what exactly you can do, okay, then there is no use of, of suggesting any sort of supplement. So you require a proper knowledge for this. Again, omega-3 fatty acids. People today, they do not take healthy fats. They take most of the time the trans fats. Okay. So healthy fats, very, very important. They needs for everything. Okay. I'm so sorry. Yeah. So omega-3 fatty acids are there, primarily found in fish, walnuts, flax seeds. Okay, these are often insufficient in modern diets today. Crucial for brain health, for women health is very, very important for all your hormonal levels. Okay, if you are estrogen dominant people, okay, you are having endometriosis, PCOS are there. Women health is very, very important to have a good fatty acids diet in your day-to-day life. Okay, it's very, very important. Okay, so and inflammation reduction because it omega-3 is very magical sometimes. When it comes to reduce the inflammation, it's really, really magical. Olive oil is really magical sometimes when it comes for the people who are having COPD. Okay, that time omega-3 fatty acids comes into the picture, and if you provide a good supplementations, if you provide good diet that time also with omega-3 fatty acids, it works like magic. Okay, but you need to again, importantly, that how much you need to do, what exactly the active form, and how the person is absorbing that nutrient. All that matters. Then again, it's a myth versus reality. Everyone healthy needs no supplement. Even healthier individuals need supplement because we have so many nutrition gaps today. We are living at that age, okay, we are not living at that age where our daddies and our nannies comes from. That time things are really pure. That times even desi ghee was really pure. Today you feel that even person is saying that this desi ghee is really pure, you find it. I guarantee that most of the desi ghee is like 50 to 60% times, okay, that desi ghee has adulterated, has toxins. Okay. So today we are living at that age where purity reduced in a very low manner, and when purity reduced, everything has impacted. Everything is being impacted. So healthy individual also needs supplementations. Then more pills always equals better health? No, not at all. Completely no. Excessive or unnecessary supplementations can be ineffective or even harmful. Doses matters the most. Okay. So the truth about is the right person with the right supplement, with the right dose, with the right benefit. Okay, you can get maximum uh, support from this help we call supplementation. Okay, so it is very important to know that what exactly the right amount you need to prescribe to your client. Okay, and the labels, the manufactured, those bioavailabilities, most importantly if they are being researched or not, and very importantly how this is going to be absorbed into that person's body. Okay. Role of supplementations like kids, if you're there's so many supplementations everyone at every age people provide. Pediatricians provide to the kids like for their growths, okay, their immune systems being really healthy. Okay. If you are adult, okay, boosting energy levels, cognitive function is very, very important. Productivity is very, very important. Elderly, you you feel more focused toward the bone health, supporting memory, strengthening immunity. People having dementia at that time, you require healthy fatty acids. That time, bone health is really really important. Magnesium are really really important that time. So that food, and in the elderly, they cannot eat a lot. You have seen your dadi nani, they cannot eat a lot. Okay, most of the things that is really healthy to you, they may be gastric to your dadis and nanis. Okay, that time supplements comes into the picture in a very helpful hand. Okay, but right amount and right knowledge is very very important. Women, okay, tailored support for pregnancy, PCOS management. Okay, and for the menopause also. Okay, so all the age requires their requirements are different, their focus areas are different. Okay, their goals are different. Okay, but with the correct knowledge, you can get everything into in a good manner. Okay, so it's important to have good knowledge for the absorption power of your supplementation. Then the safe supplementations, check the labels and the qualities. Okay, like you already read in the Neha slides, whatever she mentioned to you, that how you can check the labels, the qualities, and everything. And sometimes do not rely on the labels a lot. Whatever the uh, the pictures on the jar or the tablets is being seen and what exactly is written there do not actually apply that times actually they don't apply that thing. So check their quality is very important. Understand the doses, okay, what exactly you need, and suppose it is like 500 mg of suppose inositol you're giving. So how much mayo inositol is there in that? Okay. So the active forms and the most important, the absorbing form. Okay, that is very important to know. Avoid self-medication. This is very important. Okay. You're finding things very cheap. You're finding the advertisement everywhere is there. You can take collagen supplements, you can take glutathione, you can take vitamin C, vitamin E. Or today age is that people want to look good most of the time than want to be healthy. Okay. So doing that thing can completely worsen your health. Okay. So self-medication is a complete no for anyone, even for she's a dietitian. If you don't know exact knowledge of supplementation, try and go to a prescribed dietitians who is prescribed and have license for the supplementation, or go to the doctor. Only then have a supplement. Okay, I have seen people who are taking vitamin B12 and vitamin D, and they are just taking vitamin B12 daily, like in a very high, like 1500 mg or something. Okay, they are taking every day, every day, every day. 2 months is being, 3 months is being, 6 months is being. Toxicity is there, vitamin B12. Okay, so it's very, very important to know that what exactly you need, how much time you need it. Okay, and everything that you are taking can be toxic. So it's very important to understand and mark this line that if you don't know exact knowledge of your supplementation, do not self-medicate yourself. Seek professional advice always. Okay, your healthcare provider, your registered dietitians, and the people who are prescribed and they are licensed in doing the supplementations, tell them and ask them, then only prescribe the supplementation. So these are the most like why you actually need supplementations in your life. So these are those sort of slides. Okay. So nutrition plus supplement is equal to holistic health. Okay. So it's a helping hand, but it can be a very bad help. And also, if you don't require, if you don't have enough knowledge for this. Okay. Because it's a very concentrated form. Always remember, pills are very concentrated form of your nutrient. It can make your health worse also if you don't have good knowledge. But if you don't take it, you are taking just your diet and everything, maybe you are lacking a lot of nutrition also because your plate is not fulfilling that exact and good amount of nutrition that you actually require. Okay. So knowledge and correct knowledge, not the half knowledge, full knowledge with practical examples and good theory, practicals, and everything. It's very, very important to take care when you require to be a good supplementation prescribed dietitian. Okay, so so this is all about that. Thank you so much. Now you can ask your questions if you have any, and we can answer that. Over to you, Neha.
Thank you so much, Dipali. It was indeed a very insightful session. Okay, so we have some questions in the box, and I'm going to take it one by one. So, guys, whatever questions you have, you can please shoot it down in the chat box. We'll be taking it one by one. So the first question is about the contradictions for omega 3. See, that's a very excellent and a very important question. So even though omega-3 is considered one of the safest and the most beneficial supplements, so there are some contradictions, like conditions where caution or avoidance is advised. Okay. The first thing which I remember is bleeding disorders or in the case of surgery. So omega-3, it reduces platelet aggregation. The blood becomes thinner. Okay. It would increase the risk of bruising or excessive bleeding when taken in this condition. So omega-3 should be stopped at least 1 week before surgery, unless, advice otherwise. The second would be people who are on anticoagulant, who are on blood thinners. Okay, they should not take omega-3. Even who have like fish or seafood allergy should not take omega-3. Even who have like very high triglyceride levels with poorly controlled diabetes, they should also not take fish oil because it can sometimes, raise blood sugar slightly. In the case of hypertension also, like omega-3 can slightly, lower blood pressure. So if a person has hypertension, so before taking it, the BP should be closely, monitored, and high doses should be avoided. Even when the person has liver diseases, for example, in the case of fatty liver also, fatty liver, or alcoholic fatty liver or cirrhosis. So very high doses may increase the risk of, complications. So if you ask me what is the safest dose, it could be 250 to 500 mg per day of EPA and DHA combined. So as I told you, many capsules, they are like 1000 mg or 1500 mg, but the main ingredient, the active form which we have to look upon is EPA and DHA. So in combination, like EPA and DHA, it should be in between 250 mg to 500 mg. Okay. The next question is ashwagandha good for thyroid treatment? Okay. So what happens? Ashwagandha, it is one of the most, studied Ayurvedic adaptogen. We always talk that adaptogen hai, it is very good for stress and everything. So when ashwagandha may help actually, ashwagandha can help in the case of underactive thyroid. Okay. So in the case of hypothyroidism, it should not be taken. But when when the person has hypothyroidism, it can be taken. Okay. Even if there is stress-related thyroid dysfunction. So cortisol and chronic stress, it can suppress thyroid function. Ashwagandha, it lowers the cortisol level and it indirectly helps thyroid performance as well. So when you have to be careful, when a person has hyperthyroidism, then it should not be taken. When the patient is on thyroid medications, okay? So combining ashwagandha with thyroid medications, there should be a gap of at least 6 hours in both, okay? Or even if a person has like Hashimoto's or Graves disease, then also it should not be taken, okay? Okay, so the next question would be, in cases of malabsorption, how do you decide between oral and injectable supplements? Okay, see what happens. Uh, there are some principles, very basic principles, which we keep to decide in between oral versus, injectable supplements, because it totally depend on the type of nutrient, the site and severity of malabsorption, and the clinical, urgency. So if there is like mild or partial malabsorption, for example, in the case of when the person has been on antibiotics, or IBS is the condition, or they are suffering from celiac disease. So some oral supplements may still work if given in the higher doses, like in liquid or maybe in the powder or in the liposomal form as well. Okay. But when the person has severe, malabsorption, for example, if there is Crohn's disease, or if there is chronic pancreatitis, or they have gone through any kind of bariatric surgery, okay, so then oral route often fails. Then you need to use injectable forms. Okay. Even nutrient has to be considered. So, for example, I'll give you like one or two examples for the major nutrients. For example, when we talk about vitamin B12, okay. So when there is mild deficiency, you can go ahead with tablets. But when the person is suffering from perinaceous anemia, or they have gone through gastric bypass, okay, then injections should be given. Okay. Again, in the case of vitamin D, so high dose oral soft gels, they are often effective. But if there is like severe fat and malabsorption, uh, जो कि biliary disease या cystic fibrosis के case में होता है, then you can, give it through injections. Okay, so it depends totally on the malabsorption, whether it's mild, partial, or whether it's severe. Okay. Okay, the next question is, what if I'm doing intermittent fasting, then skipping a meal is good? Okay, so I think you want to understand the pros and cons of, intermittent fasting. So see, whether skipping a meal while doing intermittent fasting is good or bad, it totally depends on your goal, okay, on your health status or how you practice it. So, for example, when we talk about the pros of intermittent fasting, it's very good for metabolic research because, sometimes um, skipping, maybe fasting for a longer period of time, it can trigger autophagy, like the cell repair. Okay. It's good for weight management as well. So, you naturally reduce calorie intake, which can help with the weight loss. It would improve insulin sensitivity or may be also helpful for digestive rest. Okay. So, skipping meals, it gives the gut a break like lowering bloating or indigestion for some. But when we talk about the cons, it can lead to nutrient gaps, like deficiencies. It can lead to energy and mood swings. So some people may also feel low on energy or may feel dizzy or may also feel irritability, especially if they are skipping breakfast or lunch while they are still adapting to intermittent fasting. Okay. So there is a muscle loss risk as well. So if protein intake is too low in the eating window, you may lose lean mass along with the fat. And there might be some hormonal effects, especially in women. So very long fast, or we can say too frequent meal skipping, it can disrupt thyroid, cortisol, and reproductive hormones in some women. So again, it's not safe for people who have hypoglycemia or who are on any kind of medications or people who are going through some eating disorders in the case of pregnancy or in the case of any kind of chronic illness. It's not safe. The next question is vitamin D deficiency. So what is the dosage can start and how long can we take it? See, there are general guidelines for that as well. Okay. So when the level are mildly low, for example, it's in between 20 to 30. Okay. So we all know that, there is a reference range. So if it's in between 20 to 30, then you need to take it for around 8 to 12 weeks. So 1,000 international unit per day will be the correction. Okay. If you are deficient, like if it's less than 20, okay, then you can take around 3,000 to 5,000 again for 6 to 8 weeks. Okay, then you can go ahead for retesting again. But if the deficiency is severe, like the uh, to be आपका result है that is lower than 10, okay, then you have to take it until the levels normalize, and it has to be in between 5,000 to 10,000 international units per day. Okay. Dipali, would you like to take the questions from here? Or should I continue? Whatever you say.
Yes, Neha.
Yeah, you would like to take? Okay, sure.
Yeah. So the next question is where you, I think vitamin D deficiency.
As hypothyroidism prevents the absorption, so what amount of vitamin D and B12 should be prescribed? I left it here. Yeah.
The vitamin D and vitamin B12 again for the hypothyroidism, the doses would be the same, okay, because we have to know that what exactly the levels are. Okay, there are two or three levels for the vitamin B12 and vitamin D. Okay, so if you are in the mild zone, definitely for the 800 to 12, I would say. For the vitamin B12, I would the same that Neha told you about the doses, but I would say that do the test also. Okay, I have seen many people they are taking 15 mcg or something, sometimes 2000, sometimes more than 2000, and they are just continuously doing that because they think that it's just a vitamin. Most of the people think that it will not make any harm to your body, but it will. Okay. So a testing is important to know if your levels reach to the normal levels, and then you should stop that. Then we have the next questions. 40 to 50% of the vitamin D, when taken with calcium, will be absorbed in hypothyroidism condition. I don't understand this. Like, are you asking about the absorption, vitamin D3?
Hi, ma'am.
Yes.
Ma'am, I'm asking that as ma'am has said that 40 to 50% of vitamin D will be absorbed with calcium. And in
Mhm.
hypothyroidism, as there is malabsorption of vitamin D and vitamin B12, so if we are supplementing a patient with vitamin D with calcium, so 40 to 50% will be absorbed.
Okay. So
Yes.
I'll take this question. Don't worry. See,
Yeah.
what happens in the case of normal, physiology, like without thyroid issues. So vitamin D3 when taken with part is like 40 to 60% absorbed in healthy people. Okay. And when paired with calcium, vitamin D, it helps improve calcium absorption in the gut as well. Okay. So when the person is having hypothyroidism, gut motility is slower. Okay. Stomach acid is reduced. This lowers the absorption of fat soluble vitamins and minerals. Okay. So absorption efficiency, it drops. So that means if a healthy person, is absorbing 50% of a vitamin D dose, someone with untreated or poorly controlled hypothyroidism may absorb only 30 to 40%, in between 30 to 40%. Okay. Then again, when it's treated, when it's stable, when the gut health is good, then it comes back to 40 to 50%. Okay. Out of which 35% is the calcium absorption. Were you able to get the
Next.
answer?
Yeah.
Okay.
Next question is, are vegans more at risk for nutritional deficiency? Do they require supplement on a daily basis? Yes, sometimes yes, vegans and people who are vegetarian also, they are at the risk of nutritional deficiency. Sometimes vitamin D, vitamin B12, iron also. People are having big deficiency for iron also. So they require supplementations on the daily basis. But it is very important to know the levels. Okay, just do the test. Do not, because the symptoms, okay, if you're having that, like maybe you feel lethargic, so you have only the vitamin B12 deficiency, that's not exactly true. Okay, so do not go just by the symptoms that you are experiencing. It's very important to do the test. Okay, once you do the test, then only you come to know that if you having any sort of deficiency or not, or it is just because you are not absorbing the food and the nutrient that you are taking. Okay, so there is a difference between that. So do the testing and then have a correct dose of supplementation. Sometimes you don't actually require a supplementation, just a little bit of change in your diet can help you in this. Okay, just a little bit in your fat and little bit of your hydration level can help you a lot. Okay, but when it is a deficiency, means the level is a bit low, then definitely you require supplementation. Okay, we have the next question. As a postgraduate in clinical nutrition, is it necessary to do a separate course on supplements to recommend supplements for clients? That is very, very important, Nandini, because in a clinical nutrition, we don't actually have a correct knowledge of supplementation, the guidance, okay, what exactly we can prescribe. We are not licensed as prescribing the supplementation. Okay. Postgraduate student, we know about everything about the diet and the medical structure, biochemistry, microbiology, everything we know about that. But how much supplement and in what form you can prescribe the supplement, that your master's degree would not tell you. So you need a supplementation, prescribed supplementations people, okay? So they can tell you that what exactly you need when you are suggesting some supplements to your, because if we say about the manufacturing of a supplement, okay, if we say about what exactly it is in the supplementation, okay, we actually don't read a lot about supplementation in our uh, master's degree. Okay, so this is a different course. So you require that because you will not learn a lot about that. Only a superficial knowledge you will get because that is only in the case of deficiency. Then the next question is, how do you approach clients who self-prescribe supplementation based on social media trend? A very, very important question. So, see, first, just be very, just listen to them that why they need to take a supplementation, what exactly, why they are getting attracted. Okay. If they are taking something, definitely they feel something is lacking in their diet, in their life, in their health. So that's why they are attracting towards that ad or their trend or something. Maybe a skin glow is there, or hair supplement is there, or maybe anti-aging, or maybe it's because of the look or because of their lifestyle or everything. There is a need, okay, for that person. That's why the person is getting attracted toward that trend. So first know about that trend, that attraction, and then guide them, okay, that if they actually need that supplementation or not. You can only guide them if you know the correct knowledge. Okay. So knowing the correct knowledge that if the person actually need the supplementation and what amount of supplementation, or if they are taking something a very cheap supplement, are they actually going to help or not? Okay. So once you know that, then only you can guide them. So just be really patient with the client first and then give them a good knowledge. When you patiently guide your client, they listen to you very carefully. I have experienced this like 90% of the time. When they listen to you very carefully, you have to be confident in what exactly you are telling to your client. So just tell them that why they need it, they actually need it or not. So guiding them, consulting them can help you and can help these clients to get off these trends from their mind. I hope Rahida gets your answer. Okay. What are the best supplements of hair loss and to regrow hair when the person has normal protein, zinc, magnesium, iron in blood? I would suggest having a good work omega-3 acids. Okay, this is important for the hair. Biotin's also good, but biotin, I would say they work sometimes, but sometimes most of the people get some sort of digestion problem. So omega-3 is very important. Zinc, if the normal zinc is very important. Good amount of healthy fats and biotin is also important that time. Check their calcium level also. Okay, I have seen many people they lose their hair because their calcium is very low. Okay, so calcium is also very important. Just check the calcium levels also. And Neha, you wanted to add any other supplements to this question?
I would love to add vitamin E. Okay, it
Hmm.
improves the
Fat
scan blood
solid.
flow,
Yeah.
and it's very important as an antioxidant vector. Then selenium, because some people they might have hair loss due to thyroid issues. So selenium it supports thyroid and hair growth is done in the case of thyroid sensitive people. And apart from that, you can take a combination of collagen peptides with vitamin C. Okay, so they are very important to provide some structural support for follicles. So if you ask me about the dosage, it could be 5 to 10 gram of collagen peptide combined with 100 to 200 mg of vitamin C. So that should be the dosage. And it's very important. Like if you are forgetting, your vitamin B12 or vitamin D3, still collagen peptide with vitamin C is a great option. Okay, so Shana wanted to suggest some good brands of supplement. I'm so sorry. Matlab, we will not be advocating any kind of supplements here, and will not be able to, suggest any kind of brands here in the workshop. Yeah. Yes, you can take marine collagen, and if you combine it with yogurt, okay, collagen when combined with yogurt is better absorbed. I know it's like something which you might haven't listened, but collagen when combined with yogurt and taken on an empty stomach in the morning, it's very beneficial.
Mhm. Right. Next question is uh, about the zinc, the bioavailability option sources for the zinc. For me, I think zinc. I really like if the zinc glucate is there and the zinc citrate. These are a very good form, the good bioavailable form of zinc supplements. So I think this is good thing. Neha, you wanted to add any other?
Zinc, I would also love to add. See, zinc picolinate is also very good. So zinc
Mm-hmm.
gluconate and zinc citrate, zinc picolinate, and even zinc bisglycinate. Okay, that's chelated zinc. So these are some good options. Do not go for zinc oxide. Okay. So when we compare them in the for bioavailability ranking. So for zinc picolinate and zinc bisglycinate, it's very high. It's very good. Okay. Zinc citrate comes at the C. Zinc glycinate and picolinate is at the first position. Then zinc citrate, it comes at the second position. It's very good. It's a very solid choice. Then we have zinc gluconate. It's at the third position. It's widely available and it's good for short term. And zinc oxide, I wouldn't prefer. It shouldn't be taken.
Right. What should be second ingredient list of supplements of post-surgical issues apart from protein? Okay. So you can have, I generally take the zinc, calcium, vitamin D, vitamin C. Okay. Vitamin C and zinc is for really good for the healing. Okay. Calcium and vitamin D for the bone recovery. Always check the deficiency is very important. Iron, folate, vitamin B12, omega-3 fatty acids. Okay. These are some of the supplements that you can do for the post-surgical issues, in which I would say the zinc and omega-3 is something is very important because these are anti-inflammatory in nature. They heals a lot. Okay, vitamin C is very very important that time, and vitamin all those antioxidants, not just the vitamin C. I would say the antioxidant works really good there. Okay, so you can look for these supplements.
I would just like to add on one or two more. See, when you combine collagen peptides with arginine and glutamine. Okay. So collagen peptides, they provide like raw material for wound healing. And when we combine it with arginine and glutamine, which are amino acids, it enhances immune function, they improve tissue repair, and they protect gut lining as well. Okay. So you can look for a supplement which has collagen peptide, arginine, and glutamine in combination. Okay. We can move towards the next question, Deepali.
Yes, there are. What about protein supplements? How do we assess the best protein supplement like the helps to improve muscle weight, especially for people who are following regular physical activity and also who are underweight, who are on a weight loss diet? See, this is like a contradictions in the protein supplements. Okay, when we talk about the protein supplement, I would usually go with the medical condition the most. Okay, so okay. So when it comes to protein supplement, I would go for the whey protein supplement for the people. And there are some people who cannot who are having like lactose intolerant people are there. They can go for the supplements like the plant proteins are also good for them. But it is very important to know that a person like when they are having the plant protein, um, a person is for the hypothyroidism people, and most of the time soya is being added there. So
Mhm.
it's a very good options today. People are having today. They're having oats also. We have seen a lot of oats protein powder also in the picture. Lots of brands are doing that. Okay, people are doing that with the milk and some other forms of milk also. There are some toned milk products also are there. So depends on the person's choice and their absorption power and their need. I think you can choose the supplement. It's not just one general supplement you can suggest to your client. It's very important to know that what intensity of exercise that person is doing, if they can actually absorb the whey or not, because I have seen many people who cannot absorb the whey protein and they are not like any sort of deficiency or any sort of medical issues, okay? Because sometimes people they have some sort of like they are not doing a very high intensity workout or they don't need it, so they feel bloated a lot during the time. Okay, how much intensity a person is doing in their workout? Intensity is not like 1 hour, 2 hour you're doing the workout. How powerfully you're doing your workout? Okay, then also you can suggest the supplement based on their need, based on their exercise levels and if you are talking about the brands or something, so I actually don't we cannot have any sort of brand suggestions. Next question. Let's see.
Are
Are
there
there,
any,
yeah,
go
you
ahead.
can take this.
Are there any specific red flags in supplement marketing that dietitians should warn against?
Am I audible?
Yes, ma'am.
Yes, Diwali, you are audible. I forgot to unmute myself. I'm so sorry. So,
Yeah,
yes,
yeah.
are there specific red flags in supplement marketing that dietitians should warn, clients about? See, there are many, okay? So the first one would be miracle or cure all claims. Okay. So phases like cures cancer or melts fat overnight or reverse aging instantly. Okay. So no single supplement can cure complex diseases overnight. Even detox teas that claim to flush toxins, but only they act as laxatives. Okay. The second would be quick fix or instant results, like lose 10 kg in 1 week or maybe grow hair in 10 days. See, nutrients, they work gradually. Even hair, skin, or immune benefits can take weeks to months. Third would be no scientific backing. So if there are like missing references or like citing only animal studies or like vague clinical trials. So always check if claims are backed by human studies or not. Okay. Even if the person is overusing terms like natural or chemical free, claiming that it's 100% natural or it's 100% safe. See, what happens, natural doesn't mean that it's safe. For example, if arsenic is natural, okay, it's poisonous as hell if arsenic is used in the natural form, okay. So herbal products that interact dangerously with prescription drugs, they are sold as natural, it's not safe. Even mega dose marketing. So supplements advertising extremely high doses. So more is not better. Even high doses of fat soluble vitamins, iron, or zinc can be toxic. Okay. And most importantly, if there are celebrity or influencer endorsements, okay, maybe an ex-actor, an ex-athlete takes this supplement, or see, paid endorsements doesn't always carry scientific validations. Okay. Even when a supplement brand is creating FOMO, FOMO, fear of missing out, fear-based marketing, we say. So using tactics like you are toxic and, unless you take this detox powder or your body can't absorb nutrients from food anymore. So all these is bullshit. Please do not fall for it. Even if there is no testing, like, if there is no testing or certifications also. And when the brand is too good to be true. For example, burns fat, cures anxiety, regrows hair. All of these are, red flags which you shouldn't trust and you should be aware about.
Okay.
Creative use chelated form of supplements as in zinc bisglycinate or magnesium bisglycinate you're talking about. I've told that supplements that they have better absorptive potential and bioavailability. Dipali, would you like to take the next one?
Yes. Divya asked that alopecia areata, what is the how what supplements we can use? See, alopecia areata is again a hair loss, but it is like a complete hair loss. Like you can see a complete bald patch hair. Okay. Alopecia areata is not a general kind of a hair loss. So it requires treatment, it requires some sort of medications. But on that level, surface level also works a lot along with supplementations. What you are like applying that also helps in that case. Okay. Because alopecia areata is an autoimmune disorder. Okay. So you feel that the patch is like completely very satiny. That there is no even sometimes there is no even a single root is being very visible. So application is also important. Like you can use some black seed oil. Okay, you can use onion oil that times. Potatoes also works really good. Okay, on that bald patches. Okay, castor oil you can apply. And when it comes to supplementation, the supplementation is the same like for the hair growth. Okay. You can have good amount of healthy fatty acids. You can have zinc. You can have good amount of amino acids. You can have biotin, vitamin D. Okay. These sort of supplements help a lot with that. Okay. Vitamin A works good. Vitamin E works good for that people. Okay, so have a good diet with a good protein. It's important, but very important that takes care of the medications. Then we have the questions about the protein powders. How you can store the protein powder? You can store the protein powder in in a very cold place, dark place. Okay, where there is no sunlight visible there. Okay, because sunlight can make the amino acids react. They can make it inefficient. Okay, so you can make place it in a tight container because in the tight container in a very dry place should be cold. Okay, direct avoid the sunlight. Avoid the direct sunlight. That is important, and also check the expiry date. Okay, so this is important. Then we have a nice questions for the Nishita. She asked the best combinations of amino acids. She's just not talking about the brands. If you talk about the best uh, combinations of amino acids, Nishta, I would say that you can have the essential amino acids, okay, and you can have the we have the EAA and the BCAA, okay, the essential amino acids with the combination with the BCAA, okay, balanced combinations of amino acids. So you can have that, okay. The essential amino acids can have 8 to 9 amino acids are there, okay. इसका balanced combinations basically the leucine, isoleucine, and valine. They are very good for the muscle recovery. Okay, so basically the BCAA works really good for when it comes to protein supplementations and the amino acid combination. Okay, Neha, you would like to add in this?
There are actually a variety. Okay, when we talk about the best
Right,
combinations, yeah.
best combination.
For muscles, it's BCAA. For antioxidant power, it could be glutathione, glycine, and
Mm.
cysteine. Okay.
Yeah, glutathione
For
is
uh,
important when you are
for
taking it.
for
People
energy,
today are having a lot of stress and everything.
absolutely. Yes.
Glutathione is important, but again, I would say glutathione can not help everyone, guys. Okay, so today
Every
people are taking 500 mg effervescent tablet you are taking, and they are loaded with sugars, and you can get the rashes also because sometimes glutathione and sugar cannot work along. Okay, so it's very important to take care of what kind of supplement you are choosing, the brand, the label, and the bioavailability. That is very important.
and if you
Yeah,
ask
no.
me, there are more than 50 combination of best amino acids. See, and
Yes.
everything which is catered to specific conditions. I would not be able to explain all those 50 here, guys. So I would
Yes.
have a very important announcement to make. See, I myself am a certified dietary supplement practitioner. From last, this degree I have been taking. I have taken this degree 10 years back. So yes, you require a certificate course. Okay, I require a master course for that. So for that, we are going to launch internationally recognized certified dietary supplement practitioner course, which has 10 modules and 60 submodules. Okay. So 10 modules and 60 submodules wherein we are going to cover A to Z of supplements according to the chronic condition. And, there wouldn't be a single supplement or a single chronic condition that you wouldn't know about. Okay. And it's going to be a 4 month course wherein you are going to have classes twice a week. Okay. So we'll be dropping all the information, the brochure of the course, as well as for early birds, we are keeping a price discount. Okay. So we'll be informing you about it tomorrow in the morning around 12 p.m. We'll be dropping the brochure as well as we'll be dropping the payment link for early birds. So if you want to be a certified dietary supplement practitioner, that too internationally recognized, wherein you can practice not in India. Apart from that, you can practice in USA, UK, Canada, and in Europe as well. We'll be talking about the regulatory frameworks, which are very important in all these countries. Okay. So if you want to join in, go ahead with the early registrations tomorrow. Okay. And we are very happy to see all of you here. We are going to open the group now, the WhatsApp group now. I would love to have some feedbacks from you people that how did you find the class or any kind of feedback you are, actually you just want to improve us on or some whatever you feel like. Okay. So you can write about it. Okay. So I am just going to open the group in a minute, and all of you can please drop your feedback. We'll be announcing the course and everything tomorrow. The group is open for feedbacks now, guys. So please drop your feedbacks in the group. This is a very important course, and you will not be able to get this course, okay, at such good pricing and so much of knowledge you can think of, okay. So just go ahead, go through the brochure, and if you feel like that you want to be the kind of person who knows every regulatory framework and is an internationally recognized certified dietary supplement practitioner, go ahead with the course. So we would take your leave. Thank you so much for joining in. We had a very wonderful audience and it was a very interactive session. We had so many of questions. Thank you so much, guys, and all the best. Thank you so much for joining in.
Thank you so much, guys, for
Thank you.
joining. Such a wonderful session. Thank you, guys. Thank you, Neha. Thank you, everyone. Just please drop your feedback and have the access for the early bird. Okay, this could be a life-changing experience for you, knowing about the supplementation. It's really very important to know the correct knowledge of supplementation. Thank you, guys. Thank you so much.
Thank you so much. Thank you, Deepali. Thank you so much, everybody. Thanks a lot. Good night.
Good night, everyone.